Can mumps affect fertility? The truth most people ignore. Hello everyone. Today I'm going to talk about a slightly sensitive yet extremely important topic: the link between infertility and epidemic mumps. To be honest, when it comes to infertility, most people tend to blame women first, assuming that failure to conceive is solely the woman's problem. This outdated mindset really needs to change. Today I want to reveal the truth: infertility is an issue involving both partners. Moreover, a very common illness many people have suffered from may quietly impair male fertility, and that illness is epidemic mumps, commonly known as swollen cheeks. First, let's clarify where the parotid glands are located. Feel both sides of your cheeks near your earlobes. That is where the parotid glands lie. When stricken with mumps, the cheeks swell up and even distort the face shape. There are two main types of mumps. One is suppurative mumps caused by bacteria, which is non-contagious. The other is non-suppurative epidemic mumps triggered by viral infection, which is highly contagious. Most of us were vaccinated with the MMR vaccine in childhood, yet many children still catch this disease every winter and spring. Early symptoms include fever, headache, and loss of appetite, followed by swollen cheeks that make the face look puffy. The most unbearable thing is eating sour food. A bite of sour orange or a sip of vinegar will cause severe soreness and bring tears instantly. Normally, the symptoms last for 1 to 2 weeks before the swelling subsides, seemingly leaving no after effects. Swollen cheeks and fever alone are not serious, but the mumps virus is far more harmful. Apart from attacking parotid glands, it tends to invade other glands in the human body. It may attack the pancreas and trigger pancreatitis, invade the brain and cause viral meningitis. Worst of all, it can also affect testes and ovaries. Here comes the key point. Just like parotid glands, testes are glandular organs that are highly susceptible to the mumps virus. After entering the bloodstream, the virus spreads throughout the body and may inflame the testes. Notably, this virus rarely harms young children but mainly targets people who have reached physical maturity. Therefore, males after puberty face a much higher risk of developing orchitis along with mumps, and the incidence rises sharply from the age of 13 or 14. Orchitis usually develops 3 to 4 days after the onset of mumps. Typical symptoms include swollen and enlarged testes on one or both sides with severe tenderness when touched. The acute phase lasts about 3 to 5 days and the whole recovery period takes around 10 days. Currently, Western medicine has no specific medicine for this condition. Only symptomatic treatment to relieve discomfort until the body recovers naturally. You may wonder how this relates to fertility. The connection is profound. Testes are the organs that produce sperm. If only one testis gets infected while the other remains healthy, fertility will generally not be affected. However, in severe cases where both testes are severely damaged by infection, male infertility may occur. This is not groundless speculation, but a confirmed medical conclusion. So, what should people do after contracting epidemic mumps? Patients, especially teenage boys, must get sufficient rest and closely monitor for symptoms of testicular swelling and pain. Seek medical treatment promptly once such symptoms appear. Do not feel embarrassed to consult a doctor, as delayed treatment may lead to lifelong fertility problems. Apart from Western medicine, traditional Chinese medicine boasts rich clinical experience and remarkable curative effects in treating this disease. In TCM, epidemic mumps is called facial pyogenic swelling, treated with a combined internal and external therapy. Our herbal prescriptions are mainly used to clear away heat and detoxify, adjusted flexibly according to individual physical conditions. Additional herbs will be added for persistent high fever or severe swelling. However, it is rather difficult to get young children to take bitter oral medicine. Hence, external application is the most advantageous TCM therapy. Traditional plasters such as RUI gold and yellow powder, YULU ointment, or indigo naturalist powder can be mixed and directly applied on swollen cheeks. Fresh mashed cactus or dandelion also work wonders. These simple folk remedies deliver medicine directly to the affected area, quickly reducing swelling and pain with little suffering for kids and less trouble for parents. Combined internal and external treatment can enhance efficacy, shorten the course of illness, and ease children's discomfort. To sum up, infertility is never solely a female health problem, and men should also pay close attention to their physical conditions. Epidemic mumps is not a minor cold that can be endured casually. Teenage boys must never overlook testicular pain and swelling once it occurs. For families with children, ensure all necessary vaccinations are given on time. In the end, a vaccine remains the most effective way to prevent mumps. I hope today's sharing helps you gain a comprehensive understanding of this disease. Feel free to forward this content to your relatives and friends, especially those with sons. Thank you all.